Good evening, everyone. I'm LaDawn Davis. Topping the news tonight, more information being revealed on the government's National Health Insurance Plan, which is expected to be rolled out later this month. In a statement, government officials announced that the draft legislation has been approved by Cabinet and is under final review. The legislation is expected to be made public at the end of the month. Government officials indicated that the bill provides the foundation for N.H.I. Now, a few programs is also being launched by government called N.H.I. Bahamas, which is intended to make healthcare throughout the Bahamas affordable and accessible. The wider community is urged to register by getting their new national insurance cards, which will be used to register persons for N.H.I. Deputy Chief Medical Officer Dr. DeLon Brennan explains how the registration process will work.
We need them to go get their NIB smart card, because there's no way for you to be eligible to get N.H.I. if you are not eligible to register with NIB. It doesn't mean you'll get NIB benefits or anything like that, but what we're saying is you should still be eligible to have registration under NIB as a first step to getting N.H.I. Because if you're not eligible, you don't meet the criteria to be eligible to register with NIB, then you won't meet registration criteria for N.H.I. We are looking to do is work with National Insurance. So now that people are going to use that specific card to access benefits, is ideally National Insurance will have them registered and give them a smart card so that they'll be able to access those N.H.I. benefits as well.
While there has been much debate about the cost of N.H.I., officials say Bahamians can receive health care free of cost at a point of service. The cost for health care is paid for in full or in part by government, and the program will be rolled out in phases. In the first phase of coverage, which is primary care, Bahamians will receive a number of health services such as prevention, doctor visits, and other basic health needs free of cost and without any new taxes. In the initial phase, those with existing health insurance will not be required to give that up. Dr. Brennan said this will be a much-needed relief to many.
There is no, at this first instance, when primary care services are rolled out, starting in the second quarter of 2016, there's no co-payments, there's no deductibles, there's no registration charge. But even for those primary care services, such as their drugs and medications, their tests they need to have, any lab tests or x-ray diagnostic tests, things of those sorts, there's no charge for any of those. So they're able to access those services that people would have at one point had quite a burden on them financially in order to do so. They will be able to access all of those services for free as well, and not just the medications that were included in National Prescription Drug Plan, because obviously they got those medications, but it's expanded beyond those medications as well. And again, lab tests, things of that sort are also included as well. So I think it's a big relief to them financially for them to be able to access those services, even without the full vital benefit package being able to be rolled out, which will occur later in the program.